Are you concerned about your little one and wondering, would early intervention pediatric physiotherapy help your little one's gross motor skills development? Hi there, it's Neesha from Sydney Kids Physio. In today's video, I'm jumping in to talk about 3 categories of children who could benefit from proactively getting early intervention pediatric physiotherapy. By proactive, we mean we don't wait till we see little ones delayed in their gross motor skills, or we don't wait till we see odd or awkward movement patterns or abnormal movement patterns before we do something about it. Now, the categories of children who would benefit greatly from early intervention pediatric physiotherapy are: number 1, babies who had a traumatic birthing process. So that could be that there was an emergency C-section because baby was in distress. It could be that baby had a traumatic birth through natural delivery because they were stuck in the birth canal and needed to be forceps or suctioned out, and so in that process had some respiratory problems when they were born. We could also be talking about multiple birth babies. So if there's twins, triplets, and baby had to be delivered earlier than expected, babies in these categories could benefit from an assessment with an expert pediatric physiotherapist, and if needed, early intervention pediatric physiotherapy to ensure that they're progressing well rather than wait for a problem to occur before we do something. Number 2, little ones who were low birth weight or had intrauterine growth restriction. So during your pregnancy, if you were told your little one is a little bit too small for their age, that is probably an indication that little one may need early intervention to help them. Because if baby is born with a small and low birth weight, we're concerned about their development as they progress. Number 3, if your baby at birth struggled with feeding because they were floppy and they felt like they just couldn't get their mouth around the bottle or breast to feed, it could be an indication of low muscle tone, and certainly little ones like that should be assessed early and early intervention required as soon as possible to help them build the core strength to be able to feed well and to move well and to promote their gross motor skills. If your little ones had experienced any of those 3 situations, please reach out and speak to one of our expert pediatric physiotherapists here at Sydney Kids Physio. Until then, stay safe and have a wonderful day. Bye.